Hello everyone, welcome. I'm Dr. Shariful Halim and today I'm going to talk about RRR, ARR, NNT and NNH. So what are they? So RRR is relative risk reduction, then ARR is absolute risk reduction, NNT is number needed to treat, and NNH is number needed to harm. So let's first start with the relative risk reduction, or the RRR or triple R. So relative risk reduction is a relative thing. So it's actually a proportion, not an absolute value. It's a proportion of risk reduction attributable to the intervention as compared to a control. Suppose 2% of the patient who receive a flu shot develop the flu. So this is the intervention group. 2% of the intervention group develop the disease or flu. And while 8% of the unvaccinated patients, which is the control group, develop the flu. And then RRR is equals to 0.75. Why it's 0.75? Because we can calculate that RRR is equals to 8 by 2, which is the event rate in the control group, minus event rate in the exposure group or intervention group, divided by event rate in the control group, which is 75%. So here the basic equation for calculation of RRR, or relative risk reduction, is event rate in control group, or a risk in control group, you can say like that too. So event rate in control group or incidence in control group minus event rate in experimental group, commonly which is lower than the control group event rate, because we always want a positive result, which is a decrease in incidence of a disease or decrease in incidence of an outcome, divided by event rate in control group. And there is a shortcut of calculating RRR, which is 1 minus RR. And for easier memory, you can actually memorize it by RRR is equals to relative risk reduced from 1. So relative risk reduced from 1 is RRR. And here we can actually calculate the RRR by using RR. So here relative risk is equals to 2 by 8. Why 2 by 8? As you can remember from your previous knowledge, that relative risk is a percentage, or is a proportion, where we get it by dividing the development of disease in exposed, or development of outcome in an exposed group, divided by development of an outcome or event rate in an unexposed group. So event rate in exposed group divided by event rate in unexposed group is called RR, or relative risk. So here, as you can see from this example, that event rate in exposed group is 2% and event rate in unexposed group is 8%. So the relative risk should be 2, which is event rate in exposed, divided by 8, which is event rate in unexposed, equals to 0.25. So RRR should be 1 minus RR, which is 1 minus 0.25 is equals to 0.75 is equals to 75%. So RRR is a very important determinant of efficacy of an intervention expressed in relation to control event. Very important take-home message. So here is a very important question from USMLE World to help you master the concept of RRR. So you are designing a study to evaluate the efficacy of a new drug, which is named KM28. And your study will compare KM28 plus standard care, which is the intervention, versus standard care alone, which is the control group, in decreasing the incidence of recurrent breast cancer. And the FDA will approve the new drug if KM28 plus standard care decreases the rate of breast cancer recurrence by 40% compared to standard therapy alone, and the recurrence rate on standard therapy is found to be 8%. In order for KM28 to be approved, or in order for KM28 plus standard care to have a recurrence rate, have a decrease in recurrence rate by 40% compared to standard therapy alone, what is the maximum incidence of recurrent disease acceptable for women treated with KM28 plus standard therapy, which is the exposure group? This is a bit complicated question, but I think in next slide I'll make it super easy. So here we have a situation which is a clinical trial. We are doing a clinical trial, and our intervention group is CAM28 plus standard care, and our control group is standard care alone. So here we have an experiment group or intervention group and a control group, and the experiment group is, as I've already mentioned, CAM28 plus standard care, which is exposure, versus only standard care, which is control. And the information that is already given is RRR. So RRR is actually given inside the question in a subtle manner. So RRR is actually the FDA approval cutoff value. So FDA approval cutoff value will be given, or FDA approval will be given when CAM2 plus standard care decreases the rate of breast cancer by 40% compared to standard therapy alone, which is actually the RRR, which is 40% or 0.4. So as you can see from here, that RRR is actually the proportion of risk reduction attributable to the intervention as compared to control. So here this question dictates or tells you that CAM28 plus standard care decreases the rate of breast cancer recurrence by 48% compared to standard therapy alone. So the proportion of risk reduction attributable to intervention is 40% compared to control, which is standard care. So this is the RRR. So they have given you RRR in a subtle manner, and that's the trick of this question. So as RRR is 40% or 0.4, this is very one important info that we have already have. Another info is event rate in standard care, which is 8%, which is event rate in control group, which is 0.08. So 8% is converted to 0.08. And the info they actually wanted from you is event rate in experiment group to achieve a RRR of 40% to achieve an FDA approval. So for that, as we have already mentioned in our previous slides, that RRR is actually event rate in control group minus event rate in experiment group in relation to or divided by event rate in control group. So we can actually recreate this equation. So let us take event rate in control group to this side. So RRR into event rate in control is equals to event rate in control minus event rate in experimental group. So now we can rewrite this equation. So we can take event rate in experiment group and we can bring it in left side. So event rate in control group now will be event rate in control group, event rate in experiment group now will be event rate in control group minus RRR into or multiplied by event rate in control group. So the event rate in experiment group should be event rate in control group, which is 0.08, minus RRR, which is 0.4, multiplied by event rate in control group, which is 0.08. So the number we get here is 0.048 or 4.8%. So this is the event rate, or this is the expected, or this is the maximum event rate in experiment group that would bring you, or that would give you a relative risk reduction of about 48%, and that would actually give CAM28 and FDA approval along with standard therapy. So you got it right now. So I think that's a very good question to ponder and solve it again. So here we have another very important concept, which is absolute risk reduction. So absolute risk reduction is an absolute number, and this is a difference. So this is the difference in risk. It's not a proportion. This is the difference in risk attributable to the intervention as compared to a control. Suppose if 8% of the people who are received the placebo vaccine develop the flu versus 2% of the people who receive a flu vaccine, then the difference in risk between placebo and exposed group is 6%. So the attributable or absolute risk reduction is 0.06. So absolute risk reduction can also be written as risk in non-intervened or risk in control group minus risk in intervened or risk in exposed group. Very important. So we can actually calculate ARR from our typical 2x2 square. So here we have a 2x2 table. So ARR is actually risk in control minus risk in exposed. So here the minus group, this is the control group, so no intervention. So the risk of developing disease in control group is C divided by C plus D. So risk of development of disease in control group is C divided by C plus D. And the exposed group is positive. So risk of development of disease or risk of development of exposure in outcome group is A divided by A plus B. So A divided by A plus B. And the attributable risk reduction should be C by C plus D, which is the event rate in control group, minus A by A plus B, which is event rate in exposure group or event rate in exposure experiment group. So as you can see here, ARR is equals to C by C plus D, event rate in control group or non-intervened group, and A by A plus B, event rate in intervened group or exposure group. And ARR is an absolute number difference showing how good is an intervention in comparison to non-intervention. So we can actually practice our concept of ARR by case. So a study of drug A versus standard therapy in preventing recurrent pulmonary embolism has just been released. So we have our control and exposure group. So drug A is the exposure group and the standard therapy is the control group. And absolute risk reduction for drug A versus standard therapy is 4%. So ARR is equals to 4% here. And if the incidence of the pulmonary embolism with standard therapy is 6%, and there are 24 pulmonary emboli in drug A group, so here as you can see the incidence of pulmonary embolism with standard therapy is 6%. So this is the incidence of disease in control group, and there are 24 pulmonary emboli in the drug A group, and now we have the population in drug A group which have a 24 pulmonary emboli patient. Now how many total subjects are there in the drug A group? So this is also a tricky question, and I think we can solve it very easily from our previous ideas of ARR. So here let's just put some number on the board. So here as you can see the important informations that given are ARR, which is 4. So let's write down ARR is 4. The next important information is the incidence of pulmonary embolism with standard therapy is 6%. So incidence of pulmonary embolism in standard therapy is 6%. So here as you can see this is called the event rate in control group. So event in control. So in event in control group is 6%. And what we don't know is the event rate in exposure group or the treatment group or drug A group. So we have to know the event in exposure group. So we have to know that value first, and we don't know it yet. And as we know from our previous knowledge that ARR is actually the event rate in control minus event rate in exposure. So from this equation we can come out with a specific point that 4% can be written as here. So here is 4% ARR. Event rate in control group is 6%, and we don't know the event rate in exposed group, which is ER, event rate in exposed. We don't know it yet. So from this equation we can find out the event rate in exposed, which should be 2%. So from this equation we can find out the event rate in exposed group, which is 2%. Now let us use this 2% to find out the total number in subjects in drug A group. So here we can see that 2% of the people in drug A group actually develops pulmonary emboli. So those are the event rate in drug A group. So as I have mentioned that as I have already calculated the event rate in exposure group is 2%. So 2% of the population, meaning 24 people. So 2% of the population includes 24 people. So the 100% of the population will be, by simple mathematics, 24 into 100 divided by 2. So 2 into 2, 24 by 2, 12. So 12 into 100 equals to 1200. So there were actually 1200 population in the drug A group. Okay, got it? Let's go to the next question. So here we have another important concept, which is number needed to treat. So this is the number of patients who need to be treated for one patient to benefit. And the number needed to treat can be calculated by NNT is equals to 1 by absolute risk reduction. And we can remember it by way that ARR is actually about the efficacy of intervention or treatment. And NNT is also about the efficacy of a treatment or intervention. And now so that's why number needed to treat will include ARR in this equation simply. So let's just use it. When ARR is 100% or 1, the NNT will be 1 by ARR. So 1 by 1 is also 1, meaning every single patient will benefit from the intervention. But when the ARR drops to 50% or 0.5, the NNT will be 1 by 0.5 equals to 2, meaning 1 in every 2 patients will benefit from the intervention. And next we have another concept, which is number needed to harm. So this is a value which tells you the number of patients who need to be exposed to a specific risk factor for one patient to be harmed. And NNH is calculated as NNH is equals to 1 by AR. So here attributable risk is about risk or harmfulness of a risk factor. So NNH should contain AR in its equation, because attributable risk is about a risk or harmfulness, and that's why number needed to harm has AR in its equation. And if suppose a case, if AR for smokers or risk factor exposure developing lung cancer is 20%, then 20% or 1,200 people or 1 in 5 people, then NNH should be 1 by AR, which is 1 by 1 by 5, 1 by 1 by 5, and it will come out as 5. So 1 in every 5 smokers will have a chance of developing lung cancer after exposure to smoking. So I think it makes clear for you to understand the importance of NNH and use. So let's solve the case together to get actually a real idea of what really NNH and NNT means. So here we have a question where there is experimental drug A, which is tested for treatment of stage 4 solid tumor malignancies. And part of the drug company's evaluation process is to analyze survival data after 3 months of treatment. And the results are given in the table below. So here are the results. And which of the following best represents the number needed to harm for drug X? So as I have already mentioned, to calculate the number needed to harm, you have to first calculate the attributable risk or absolute risk. So you have to calculate the absolute attributable risk, as I have mentioned in this equation. So we have to calculate the attributable risk first. And as you might remember from our previous discussion, that attributable risk is the risk attributable to a specific exposure or after a specific exposure. So risk between a risk difference between exposed group and non-exposed group. So let us solve this question by identifying the risk between exposed group and risk between non-exposed group. So here as I have already mentioned, the NNH is 1 by AR, and AR is equals to attributable risk, which is event rate in exposure group minus event rate in non-exposed group. And here we are calculating NNH, so we will be taking concerns of harmful event rate, which is death. So we will be considering death as the harmful events. So those are the harmful events. And AR, now AR should be converted as death rate in people exposed to drug X, which is the exposure group, and death rate in people exposed to placebo or normal drugs or nothing. So here the death rate in people who are exposed to drug X are 60 out of 20 plus 60. So here those are the people who are dead, and those are the total population. So total population who are treated with drug X were 80, and among those 80 people, many of them died, so about 60 died. So the death rate in people exposed to drug X is 60 divided by 20 plus 60, and the death rate in people treated with placebo is 38 divided by 38 plus 38. So 38 divided by 38 plus 38. So now we will get an attributable risk of 0.25. So as you know, the NNH is 1 by AR, so 1 by 0.25 equals to 4. So actually 4 patients needed to be treated for 1 patient to be harmed or 1 patient to be dead. So that's all from me. Thanks for watching my video. I hope it helped you a lot, and you have to actually practice those equations and remember them, and solve as many questions as you can for making the ideas of those important concepts very clear, crystal clear.